I'm doing my speech on educational barriers of Tourette syndrome. Getting an education is so much harder for people with Tourette's than we thought. Many children with Tourette's aren't receiving the educational help that they need in their schools. Today, I will be talking about what Tourette syndrome is, potential learning drawbacks, and how to meet a child's needs in the classroom. According to the National Institute of Neurological Disorders and Stroke, Tourette syndrome, also known as TS, is a neurological disorder characterized by repetitive, stereotyped, involuntary movements and vocalizations called tics. Some of the most common motor tics include eye blinking, head jerks, throwing, or making faces. Some of the more simpler motor tics would include the blinking and the jerking. There are more complex motor tics, which would include the hopping, throwing, pinching, or making faces. Some of the more common vocal tics would include whistling, grunting, foul language, or repeating words or phrases. There are simple vocal tics, which include the whistling and grunting. There are more complex vocal tics, which would include the foul language and repetition of words or phrases. There can also be different types of speech patterns that may occur with or without the vocal tics. Some of these may include unusual speech patterns, like tone accents or immature speech. Some of the tics can fluctuate every now and then and may or may not be worsened during the childhood years. It is not uncommon for tics to change over time, and some students may be able to suppress some of their tics for a short period of time. Therefore, there are many environmental and mental factors that can make a student struggle in the classroom. Stress, anxiety, holidays, illness, or school and home life transitions can affect the student environmentally. If a child is also diagnosed with ADHD, OCD, or any other learning disability, may affect the student's ability to learn. Many mental ill conditions are connected to Tourette syndrome. Some of the most common conditions include OCD, ADHD, other learning disabilities, or executive dysfunction. OCD, or obsessive compulsive disorder, may be affecting the way the student learns. Symptoms can disrupt the other students and distract your student from their work and may result in the other children isolating them. ADHD, or attention deficit hyperactive disorder, may include impulsivity, social immaturity, or short-term memory difficulties. Executive dysfunction can cause the student to have a hard time forming goals, organizing, break down long assignments, and dealing with the unexpected. However, according to the Tourette Association of America, there are a few things we can do in the classroom to help these students and their learning experience. We can make some changes to the classroom environment, including trying to schedule our days around the students' most productive times, provide them designated seating and special test-taking locations if they are needed, allowing them extra test-taking time, and give them non-timed tests to reduce some of the stress and anxiety. We can also give the students special help if they need it. We can allow them to leave class a couple minutes early so that they can beat the overcrowded, loud hallways that may be overstimulating. We can give them options when it comes to written assignments. Some of the options are to type notes or assignments on a computer instead of writing them down, giving them already printed out version of the notes, or even use a scribe, which is somebody who can write them down for them if there is the option. We can also have them give an oral report instead of a written report, and we can also offer them shortened assignments if possible. If your school has the option, you can give them the help from a TS, educational in-service teacher, for help during and after classes. If the student is still struggling, they may need to be placed in a special school for students with TS, may need a tutor or a small or special classes. In conclusion, although Tourette syndrome is a difficult and complicated disorder, there are many ways to help make living with it a little easier. As teachers, it is our job to help all of our students learn the best way that they can, and using some of these strategies is a step in the right direction. It will never be easy for the student with Tourette syndrome, but using some of these examples can help lessen the level of stress or anxiety that they are under.